What if something as ordinary and personal as your sexual habits could influence your prostate health? It sounds like an exaggeration, but this idea is actually rooted in long-term, peer-reviewed research. Today we're taking a clear, science-based look at a question that's sparked curiosity for years. Does ejaculation frequency affect prostate cancer risk? The answer may shift how you think about one of the most common cancers men face. Prostate cancer affects roughly 1 in 8 men at some point in their lifetime, making prevention worth understanding. We already know age, family history, lifestyle, and overall health shape cancer risk. But scientists have been exploring whether something fully within your control, your ejaculation frequency, plays a meaningful role as well. To understand why this question matters, it helps to know how the prostate functions. This walnut-sized gland sits beneath the bladder and produces seminal fluid. Between ejaculations, that fluid can accumulate, which is where several interesting theories begin. One major idea is called the prostate stagnation hypothesis. It suggests that if fluid sits in the prostate for long periods, potentially harmful compounds may accumulate, possibly encouraging cellular changes over time. Ejaculation, in this view, acts like a rinse cycle, regularly clearing out substances the gland doesn't need. Another perspective involves stress. Frequent sexual activity, solo or partnered, may reduce psychological tension, and chronic stress has known links to inflammation and weakened immune function. A third theory proposes that ejaculation might support a healthy prostate environment, including the way the organ uses nutrients like zinc and citrate. But theories are only part of the story. In 2016, researchers analyzed data from more than 31,000 men who were followed from the early 1990s into 2010, nearly 2 decades of information. This long timeline matters because prostate cancer typically develops slowly, making long-term patterns essential to study. The participants answered detailed questions about their ejaculation frequency during their 20s, their 40s, and the year prior to the survey, along with lifestyle details such as diet, exercise, smoking, and stress. The standout finding was that men who ejaculated 21 or more times per month had about a 20% lower chance of developing low-risk prostate cancer compared to those who ejaculated 4 to 7 times monthly. This doesn't mean frequent ejaculation prevents all prostate cancers. The association was strongest for low-risk forms. Still, given how common these types are, the data is meaningful. Even so, it's important to interpret this information realistically. Men who report higher sexual frequency may also differ in other health-related ways. Perhaps they exercise more, have better cardiovascular fitness, or maintain healthier relationships. Those factors alone can influence cancer risk. Another possibility is that healthier men simply have stronger libidos in the first place. And of course, averages across tens of thousands of men can't predict what's right for any single individual. So what should you actually take from this? First, don't feel pressured to chase a specific number. Sexual activity should never feel like a chore or an obligation. Second, if you already have a high or healthy level of sexual activity, there's no need for guilt or concern. It's normal, and may even come with some protective benefits. Third, remember that overall prostate health depends on many factors: regular exercise, nutritious eating, maintaining a healthy weight, not smoking, managing stress, and staying up to date with screenings, especially after age 50 or earlier if you have risk factors. And finally, pay attention to your body. Changes in libido, erections, ejaculation comfort, or urinary patterns should prompt a conversation with a healthcare professional. Statistics like these can carry emotional weight. If your sexual activity isn't frequent for personal, relational, or health reasons, it does not doom you to cancer. A 20% reduction in one category of risk doesn't outweigh the dozens of other influences on your health. Life changes, circumstances vary, and your well-being is shaped by far more than one habit. In the end, the research points to a possible protective relationship between regular ejaculation and certain prostate cancers, but it isn't a mandate. What it does reinforce is that a healthy, shame-free intimate life, whatever that looks like for you, is a normal part of overall wellness. Stay informed, take care of your body, get regular checkups, and don't let fear or myths shape your choices. Your health journey is long, nuanced, and worth approaching with confidence and clarity.